Good afternoon, and welcome to this session on advising policy and mapping progress. My name is Karen Bosworth. I'll be your moderator today. I'm with the Canadian Observatory on Homelessness. I'd like to start by acknowledging the City of Halifax is situated in Mi'kma'ki, the ancestral and traditional lands of the Mi'kmaq people. Our first presentation today is Strategies for Conceptualizing and Measuring Housing Stability by Dr. Tyler Frederick from Ontario Tech University.
Oh, that's so nice. Thank you very much. This is going to be hard for me not to pace around, so you may see a lot of arm flailing. Yes, so just a quick acknowledgement. So most of the presentation is kind of conceptual, but I do talk a little bit about some kind of preliminary data analysis we're doing, and that comes from a project funded by Making the Shift, and the project team is listed there, so a great group of folks. And I'm realizing I missed a person, one of our RAs in Montreal, Nicolas, so I apologize there. So in terms of kind of what I'm interested in with this presentation is I personally kind of like this question of sort of thinking about like, well, what do we mean when we say that someone has stable housing? And I like that question. I think it's interesting in part because it's important to a lot of the work that we do. So it's important for kind of identifying who we think is at risk, right? Because if they're unstable, then they're at risk. It's how we gauge the appropriateness of someone's housing for their needs, right? If we're sort of providing a program and that person remains unstable, or that instability in that program might signal that there's something not optimal about the fit for that person. And then it's also sort of key to how we do evaluation and measurement, right? It's sort of a common measure that I think kind of gets discussed, but it isn't always sort of that well defined. And then I sort of also like it because thinking about it for me gets me thinking about, well, why do we do the work that we do, right? What are the kind of implicit or explicit goals that we have in mind, right? And so how we answer the question of stability kind of points us in some direction. So is the priority we're aiming for just kind of a roof over someone's head, avoiding homelessness? Okay, well, that might point us towards a particular way of thinking about it, which, maybe days housed is sort of good enough. Or, is the priority a feeling of stability or satisfaction for that person? That's what we're kind of really aiming at, in which case it might point us towards subjective perceptions or other measures. So that's sort of a bit of that, just kind of framing the question or framing my kind of interest. So the other part of it is that it's this stability. Housing stability is this sort of common concept, but there's just a lot of varied terminology that kind of gets mixed in there with it. So sometimes we're talking about housing stability, sometimes we're talking about housing security, sometimes it's housing need, housing satisfaction, tenancy sustainment, et cetera. And then the sort of problem, kind of compounding problem, is a lot of these terms are also sort of not terribly well defined. So it's a bit of a soup. And so the aim of this presentation is to explore different ways of conceptualizing and measuring stability, kind of drawing from the research literature. I'm going to kind of pitch you all in sort of a conceptual model that makes sense in my brain. I'd love to get sort of feedback, and then just share some recent findings from based on a measure that we're kind of trying to develop. So just to kind of jump ahead a little bit, in terms of kind of framing my general approach, I don't think there's one way to conceptualize or measure housing stability. So I'm not going to pitch this is what housing stability is, and this is like the one way to think about it. I think it works best as a multifaceted concept, and I think there's strengths and weaknesses to the different ways that we think about it. And I think it's just, as practitioners or researchers, it's just kind of recognizing those strengths and weaknesses. So just some kind of, this is drawing on kind of a, past research we've kind of done on the topic. And so just kind of providing a bit of an overview of sort of like, okay, well, how does housing stability get measured? So there's sort of two main kind of strategies in the research literature. One is sort of single measures, where they just kind of have one question, right? And that's their proxy, or that's how they kind of define it. And then there's other sort of multiple measures. So in terms of single measures, The most common, and these will look probably very familiar, so housing type. So basically, that often breaks down to someone is stable if they're not homeless, and if they're in some kind of housing, maybe they're considered stable. But they can also sort of, some studies kind of define it differently, that if you're in subsidized housing, that might not be considered stable, or transitional, but market might be. Sometimes it's defined in terms of rent versus owning. So lots of variation there. Another strategy that's pretty common is days housed, as well as number of evictions or forced moves. And I think forced moves is just meant to kind of broaden kind of beyond sort of a narrow sense of being evicted. Maybe you're forced out because of a building gets condemned or something like that. So pros to these sort of single measures, they're simple to define, which is useful. Simple to define and measure, and then they're easier to kind of standardize and compare, right? If you're sort of looking across a bunch of programs, if you just have this one measure, that's nice and simple. The con, or the downside, is that, as you're sort of probably detecting, there's no information there about the quality or experience of that housing, right? Sort of maybe someone's hating every minute of it, maybe they're barely hanging on by their fingernails, and sort of a sense of days housed doesn't sort of tell us that. Days housed conceptually, or these kinds of single measures, also kind of assume some sort of correspondence between the past and the future, right? So if someone has been in housing for 3 months, we're sort of seeing that, kind of implying that they're going to continue to be kind of on that trajectory. But again, like someone might be just kind of hanging on by their fingernails, and something might be about to shift in their life, and that's not necessarily captured here. It's also sort of in terms of establishing this kind of dichotomy between someone being stable or someone being unstable, it's kind of an arbitrary cutoff, right? Is 3 months in housing stable? Is 6 months? Is a year? And I imagine if sort of for folks in the room, there's probably lots of varied answers to that, and it probably depends on the person and the situation, et cetera. So, okay, so thinking about multiple measures. So in the research literature, there's lots of different places, lots of different studies to cite. These are not the only ones by any stretch. These are 3 that sort of are worth kind of pointing out. I'm not going to kind of dig into each of them. That will be sort of too tedious. But it's really to kind of see that when it comes to these kind of studies that kind of aim to gather some sense of stability by pulling together these multiple measures, it's a bit all over the place. And there's no kind of real standard approach, or even kind of, there isn't much uniformity at all. And I'm not sort of critiquing these studies in that sense. Like they're just, I think, taking whatever available information they have and kind of bringing it together and trying to get a more holistic picture. So that brings us to that sort of positive. The reason that we might do this, we might bring these multiple measures together, is that it is more holistic than just a single measure, can capture multiple viewpoints. And then I think the other big kind of advantage is these multiple measures most of them tend to bring in some sort of subjective element to consider alongside sort of more objective elements. And then there's some sense that, that captures something unique, or can be kind of a good catch-all. Cons, or the downsides, it's not always obvious what dimensions to include, right? Like I said, it's really quite mixed. And the wording of the components can be kind of challenging to get right? So how do you kind of define these various sort of items, right? The wording really kind of matters. I think sort of people can kind of, how you ask the question is really going to shape what kind of answer you get back. And so wording does really matter. And again, there's not much standardization. So with that kind of framing that out, I'm kind of moving towards my sort of pitch. And in making that sort of pitch, I'm sort of definitely not alone. Like I'm sort of drawing on lots of other ways of thinking about this work. So I'm not, again, sort of making the argument that or sort of housing stability is sort of like the measure to be considering. Right? We can kind of talk about lots of different conceptualizations. We can talk about social integration. We can talk about sort of recent work about, on thriving. Are people thriving in their housing? We can think about sort of fit, or this kind of dynamic 3-factor model from Sylvester and colleagues, right? Thinking about this kind of relationship between a person, their housing, and their support. You can think about all this interesting work about home, right? How people feel in those spaces. There's some interesting work by Cox on housing security, thinking about it kind of using like government data. So they kind of want to sort of use government data to kind of get a sense of how many people in the, in a given sort of area are sort of housing insecure. And that's really their sort of approach or their take is very similar to core housing need and sort of from CMHC. So there's all these kind of different concepts floating around that all relate and all have value, and sort of I'm kind of pulling from them a little bit in my conceptualization. So my sort of pitch is to kind of consider housing stability along 4 kind of interrelated but slightly separate dimensions. So one of them is thinking about sort of housing need. So that kind of riffs on the CMHC idea that if their housing is inadequate or unaffordable, then we could sort of inherently see that as unstable. Another kind of conceptualization is to think about the risks or threats to someone's housing. So that's kind of a more forward-looking thing. So what kind of things do they have going on in their life, or what sort of conditions are they living in that may eventually sort of put them in a difficult situation or force them to leave prematurely. I also think it's really important to ask people about their feelings of stability and their sort of satisfaction in the places that they are. And sort of using that as a holistic indicator, right? Because we can't ask about every threat, we can't ask about every situation, but a person can give you a sense of how they're feeling in that space. And then this idea of a safety net. So shocks happen to everybody. And so I think if we want to think about people as being stable, we probably want them to have some sort of safety net if something unexpected does happen, right? And so off to the side on that sort of chart there is these conceptual assumptions. And so the scale or the kind of concept I'm pitching here is a little unconventional in that I'm not really sort of talking about these being kind of these clean sub-concepts that all kind of feed back. So I'm assuming in this kind of conceptual model a bit of messiness and a bit of sort of non-alignment. Yeah, these are vantage points, different kind of ways of thinking about stability. Then when you kind of take them all together, it might give you a holistic picture, but they do offer their own kind of, their own little perspective. Part of why I don't think these are sort of clean subcomponents, as you might expect in kind of a traditional quantitative scale, is that trade-offs are really common. So one thing you look for when you're doing scale development is like, okay, are your items correlated, right? But when you talk to folks who are experiencing homelessness or are marginally housed, it was really quite rare to see people, or actually often you saw like adequacy and affordability heading in opposite directions, right? If someone had an adequate place, it kind of by definition had to be unaffordable, and for it to be affordable, it generally speaking wasn't adequate. And so that sort of adds in a bit of that kind of conceptual messiness that we're assuming that there's trade-offs that people are having to make. And so everything's not going to be heading in the same direction. How am I doing time-wise? Okay, thank you. So I kind of moved through that quickly, so hopefully it wasn't too quickly. Okay, so then, yeah, this brings us to this kind of tentative scale that I've been sort of working on for a while in various projects. I'm kind of terrible at scale development, so I've gone about this a very unscientific, kind of messy way, and so that continues. And I've changed the name a bunch of times because I was calling it a scale, and then I realized it's actually not so much a scale, technically speaking. It probably better is described as an index, which is maybe getting into the weeds a little bit, but so it has these 4 components. So housing need is, I think of it as kind of a dichotomous index. So it's 2 questions, and it's sort of basically quality issues and affordability. And if they say that they have major quality issues, then on that dimension, they would be considered unstable or unstably housed. The other sort of subcomponent is subjective stability. So there's 5 questions there. So there we're sort of asking things about satisfaction, like housing satisfaction. Do they feel settled? Do their life feel stable to them? Does their place feel like home? And do they feel like they're making progress on goals? And that set of questions came out of some previous research that felt that those items hold together quite well and do actually do in particular, that question of feeling settled in your place in past research was the only item that correlated with someone's future housing status. Of all, and I'm talking like all the indicators we threw at it, that was the only one that seemed to kind of correlate with their future. So at any rate, so safety net, asking about do they have money saved? Do they have an alternative place to go if they lost that spot? And do they have supportive people in their life? And then asking about some of what we think are kind of the main threats. I have absence of threats because you can kind of define it either way in the scale. You can reverse code items to make it sort of be a measure of threat, or you can kind of code it in such a way that it's an indicator of stability. But so this is like things like having necessary skills for support, following landlord's rules, conflict in the home, problematic roommates, and things like that. So in this recent examination, I think I'll probably time out here, but just to say we had for sort of, scale people, our Cronbach alpha was 0.76, which is decent. It's not amazing, but it's decent. So it's showing that these items, when you all add them up, they do hold together. So there is some things pointing in slightly different directions, like that adequacy, affordability piece. But for the most part, it can work as a scale. And then there's a subscale in here, which is the subjectivity, the subjective perception of stability. This is kind of stats on this particular sample of folks. So maybe not that meaningful, but you can just see kind of the relative differences. So the one to kind of note is people safety net. Of this group of young people who are transitioning to, this sample of young people who are transitioning to housing, not many of them had a very comprehensive safety net. And that was the other thing that kind of worked against us in terms of everything correlating, right? If people, if lots of people don't have a safety net, then that's not going to help your correlations. 44% reported 2 to 3 threats out of the 8 that we asked about. Safety net was kind of the odd one out in terms of not really correlating that well. And then the other thing that we sort of did with it that I kind of like to do is play around with profiles. So using these various components, you can kind of group folks into these profiles. And so what I like about it is at the far end of this kind of the people who are super stable, let's say, are more stable, and the people who are kind of really struggling, that all kind of makes the dynamic there is maybe more kind of intuitive, right? Like, and everything holds together there. Where the subscales, I think, become more interesting and these profiles matter is in that kind of messy middle, right? You have folks who, there's sort of folks who, it's like a small group, but they are, have kind of high threats, but they feel pretty stable. And so it's kind of interesting to kind of think about what's going on there. You're kind of living in inadequate housing. You have a lot of kind of threats in your housing, but you're feeling pretty good. And based on some preliminary past research, my sense is it's based on, it's relative, right? If you've been sort of really unstable, then having that bed is going to feel really good, and you feel good, you're feeling optimistic. That was the other piece of it too, is identifying there's folks that you can see clearly sort of having this optimistic kind of coping strategy, which I think is really important for their survival. But it's, this time, all my past housing, every time I moved home with mom, it never worked out, but this time, when I go back with mom, it's going to be good. We're excited. So it's that sort of coping strategy that ends up creating some kind of interesting mismatches. And so from a kind of provider point of view and a researcher point of view, you get to kind of unpack maybe a little bit that messiness, and you're not kind of saying like, well, hey, you said yes on this one question, so you're stable, or you said, yes on this or no on this one question, and you're stable. It's allowing a bit of some different vantage points. So I think I will leave it there. Happy to chat or answer any questions. And thank you very much. Feel free to reach out.
Thanks, Tyler. I can anticipate lots of questions about your research. It sounds really interesting. So we'll hold questions till the end of the session. Obviously, not your first rodeo. So our next presenter is Abe Uchorn from Western University. He'll be speaking on removing the constraints on preventing and ending homelessness. Sorry.
Absolutely. Whoa. Great. Well, thanks everyone for staying after the fire alarm. I was watching people leaving en masse. Sorry, I don't have a cocktail to offer you, so we'll try not to keep you away from that for too long. I'd acknowledge Sybil Kustamir, a PhD student with myself at Western University, who I come up with these ridiculous project ideas, she delivers them. So the hard work behind this project. This particular project, so my background is street nurse and now academic. And this particular project comes right from my heart, which was the experience working as a nurse of loving the work, loving the people, and being really friggin' frustrated with the system, right? And watching our caseload doing this and this and this, right? And attending too many memorial services, even though we were doing amazing work with each patient, right? And so it comes from that. And it's also, secondly, it's intentional I'm presenting it at this conference because it also speaks to a little bit of, if you did an ethnography of this conference, where if you were like me and have been here since the very first one in, I think, 2013 Ottawa, it was focused on like homelessness is a problem to be solved by the homelessness system, and it's a technical challenge, and we train everyone with the right approach, and we'll fix this thing. And then today, you even hear like the minister talking about like this is a systems thing, it's broken systems, and you hear Tim talk about that, and I've heard everyone prevention group, right? So the shift away from like we can solve this, each of us by just doing the right technique, housing first, to like there's a bigger problem here. And that's the passion behind this work. So I hope some in this room share that passion with the cast of thousands of this project team. So we said everyone come on in, academics, lived experts, policymakers, service providers. If you're passionate about this issue and you want to take sort of a structural lens on ending homelessness, come on in. And so great, incredible team. Kudos to all of them. All right, so we have a national housing strategy. So actually dating myself even further, before the Canadian Alliance conferences, in 2005, there was the first national conference on homelessness at York University. And at that time, a declaration was put forward by Kathy Crow and Stephen Gates and Tim Aubrey. They wanted a national housing strategy. And they said it's a shame to Canada that every other country of the OECD has one and we don't, which actually wasn't true, but things were harder to Google back in 2005. But they made the point, right, that we needed a national housing strategy. And so we've got one. Well, we still have homelessness, right? So I think there's work to be done on this national housing strategy, and so it's that we have strategy, but maybe not all of the strategy that we need. So we take some starting points here, right? So we take a point that housing is a human right. That's going to be important as we think about sort of how does that become systematized, right? So what is eviction in the context of housing as a human right? What is discharge from hospital in the context of housing as a human right? And also we took position homelessness serving system cannot solve homelessness independently. Right, and very specifically, and I'm glad to see Councillor McAllister from London, welcome. Great to have some politicians in the room. Explicitly, it's not that we aren't doing things well, right? Because in London, I would say like we've always tried to push to sort of the front of evidence-based practices and that sort of thing. But even once we roll out our whole of community response, that's our current iteration, if there's other factors in play, we will see improvement, but I don't think we'll see the end of homelessness. And so really thinking about prevention as well. So you'll see that come through. So. And then my other sort of okay, I'm starting to sound like I have a lot of frustrations. I'm a happy person, but another frustration that I have is with our plans, our current plans. And so part of this project, we're reviewing community plans, not just from across Ontario or Canada, we're looking at community plans from around the world. And one of the questions I'm asking of those plans is, if we implemented this plan to end homelessness in Peru, would it end homelessness in Peru? And you look through the plan, you're like, okay, we would do all this, and actually, no, we wouldn't. And I think it's probably true of all of our community plans, right? If we fully actualize this community plan in your community, would you end homelessness? Unfortunately, probably not, right? And so current planning is constrained, right? It's constrained by 4-year government cycles. It's constrained by pragmatic budgets and all of those sorts of things. So almost all of our plans are like plans to reduce homelessness is really what we're looking at. And so I said, well, as academics, we have a luxury. We have a luxury to dream, think, talk about tough things, make fun of governments, but not my local council. And so I said, okay, let's do it. Let's say, what would it actually take to prevent and end homelessness? What would a framework to actually, not all this pretend stuff we've been doing, what would it actually take to end homelessness? And so that's been the adventure of this project. So the piece that I'm sharing with you is just like our first iteration of part of the findings. It doesn't include any of the international analysis, comparisons, critical policy analysis, that sort of thing. It's a first snap, and I'll tell you what it does cover. This work is thanks to the Ontario Alliance to End Homelessness, which is one of the CAEH networks, which is a great gathering. So I was the chair of the London Homeless Coalition for 6 years. It felt very lonely at times, and so having an alliance of coalitions or alliances is amazing. If your province doesn't have an alliance of alliances or alliance of coalitions, I invite you to do that. Of course, Shirk for giving us the cash, and Western for not piling too many things on my plate. Okay, so what did we do? We talked to 70 experts, again, folks with lived experience, policymakers or people who deliver the policy, service providers, academics, activists, and advocates. And we asked them all these questions about what's working, what's not, where's the hope in the system, where's the failures, what would you need, what would success look like, how would you end homelessness? We went through this and we sort of categorized all the different areas. And then we also then did a second analysis where we looked at what are sort of the key policy messages, policy transitions, changes, that sort of thing. And we did have a nice diversity of folks. Sorry about the font size on that. But folks, some who had been in the sector for quite a while, many who were relatively new as well, and representing academia, management, administration, policymaking, et cetera, and some diversity as well. Okay, so we talked to all these brilliant, experienced, pained people, and what they told us was there's a complicated system. And it's an interesting thing, right? Because I depending on my audience, I'll be like, homelessness is simple. Or I'll be like, homelessness is complicated. So you're the homelessness is complicated crowd, right? And of course it is simple, it's housing, right? But we're gonna look at all of the pieces, right, that create homelessness, and then where are those like potential policy levers, right? What can we change in here? And so again, apologies for font, and I don't expect you to see this. One is these are posted, so you'll be able to zoom in and browse it later, and I will zoom in as myself. But in the overall picture, right, is that there are macro, meso, and micro factors. Everything from government policies and how governments work together or don't work together, down to intersecting systems, down to how we actually deliver service at the ground level. And all of those things are potential for change, and all of those things both create homelessness and have the hope of ending homelessness. So I'm just gonna do like a quick point through, because this is the sort of the descriptive part. It's the more analytic part that I think is probably most interesting to you. So at the macro level on your left, you'll see governments, so different orders of government. It's an Ontario-centric picture on that. But who's funding? Where's the funding coming from? Is the funding sufficient that's coming from the different orders of government? How's it flowing through? Hypothetically, is the federal government giving the provincial government a whole bunch of money that doesn't flow through? It just uses to pay down its deficit, hypothetically. At the next level, it's like, what are the foundations, right? And so anti-Indigenous racism, the need for decolonization, the need for gendered lens on our work. And then on the right, are all the different aspects that make the housing system, right? So everything in the housing system we know influences rates of homelessness, causes of homelessness, as we've seen in a very sort of glaring and dismaying way currently. So at the meso level, you have the actual sort of homeless serving system, the different pieces of that from transitional housing to supports in housing, how people get into the system, such as through coordinated access, which can be done well and which can be done very harmfully, the planning of the system, and then all the different other things like justice, like child welfare, that are sort of feeding people into homelessness right now. And then at that sort of ground level is basically the tools that folks have who are delivering services. The practices that they're implementing, the different sort of approaches they have to help people out with income. I was just in a rent bank, one which I will talk about in a second again. But all sorts of tools to like try to help people in crisis, try to prevent, try to get people out of homelessness. So it's a complex system. There's lots of levers here. However, as we looked at sort of the analytic part about where are the potential shifts, there is going to be a simpler picture at the end of this. We haven't drawn that picture yet. Our artist is unfortunately has COVID, like 23% of the Ontario population this fall. But we have some shifts that are going to get us to that picture of what a better functional system actually looks like without homelessness. So here are the things that folks told us are going to be fundamental improvements. The first one is income support. So we have to address poverty. And we have to do this in a real way, not a patchwork way. And we'll talk about the problem with patchwork ways. But even a comprehensive poverty reduction approach alone won't end homelessness. And I will explain that. But we do need to address poverty. We need to get realistic about not a guaranteed income, I would say, because not a basic income, because I don't think we need to give money to people who have money, but a guaranteed minimum income, I think we need to talk about, right? So getting everyone above the poverty line. And if you're working for your money should not be poverty wages, right? So that is a fundamental, foundational shift we need to make. However, if we gave everyone tomorrow a guaranteed minimum income, we would still have homelessness, right? And rents, rents would go, whoa, right up through the roof, right? And we'd have no more housing. We would just have everyone having a lot more money and paying it on the housing that we have, right? So it is an important step, but that if you just turn that policy lever, you don't end homelessness. We need a managed housing system. So the system itself has to constrain cost and constrain rent. And so that includes several factors. That could include rent control. I will happily have a beer with you over why everything that's been written about rent control as like a failure is actually problematic. We won't get there without rent control. And having done rent control poorly in the past, not working, is not good defense of why we shouldn't have rent control. It's a defense of why you shouldn't do rent control badly. And then social housing. And so it was interesting that you'll notice the minister said non-market housing, which is great because like they know what they need, and we'll hold their hands and we'll get them to say it. Let's say it all together, social housing. No, and so we need, if you want housing that is truly affordable, right, and that is going to stay affordable and not like run out after 20-year agreements or 30-year agreements, or only be affordable to like a portion, et cetera. We're gonna need to control rents, we're gonna need to have social housing. However, if we had a lot of social housing and we had a guaranteed minimum income, people will struggle to stay in their housing, right? So what do we need? That's not the button. We need supports to keep people in their housing, right? And so one of the ones I like to think about is I like to think about eviction. And to me, I think that we can figure out eviction. And I think we can do eviction in the context of housing as a human right in two ways. The first is that we are a much more intelligent, responsive system to help people when they are in crisis. And then secondly, we think of housing transition rather than eviction, perhaps, right? So if folks aren't working out in their current housing, and landlords do have their own rights as well around who's in their housing, then maybe that person needs to be supported to move into a different type of housing, right? And not evicted, but transitioned somewhere else with the right supports, the right systems, or the right cost. Permanent supportive housing, which plug, my PhD student is presenting on tomorrow morning. Our research on permanent supportive housing is sort of the way to go. One of the things we've really noticed, and so scattered site, like off-site supports that go to where people are, amazing, you guys do great work. That's really hard work. Having the supports in the building where people live is, at the end of the day, a more optimal model. Pre-housing loss support as well. All right, so those are three essential shifts and an overall conceptualization that is gonna help such a system work is that homelessness should be rare and short. So homelessness should be rare in that it should be prevented as often as possible. However, we will not eliminate all crises, right? So Finland, who has almost eliminated homelessness, still has a crisis landing system. They have public housing. They still have crisis spaces, right, for people to land, right? And so if you're leaving violence or something like that, sometimes you do end up unhoused. But those crisis spaces cannot have any barriers. If we're going to be a comprehensive homelessness list system, we need to let everyone in, right? Everyone needs to be able to come into the crisis door to get the help, if the help is going to be there, right? And this can include like that concept of housing first, right? As philosophy is rapid, rare, and short. And then no discharge from other systems. And that can be done as well. Wales, the Housing Wales Act, which is not related to the animals you would sightsee here, it's the country. The Housing Wales Act says people cannot be discharged from child welfare into homelessness. It puts the responsibility on the council to house everyone exiting child welfare. So we can do that. We can put these things into law. We can make these policies. All right, so to check the boxes, we need to have a tough conversation about social housing. I highlight this one because this came up again and again and again in our interviews, is like, we've been working now for 1983 to 40 years. We've been working around that like giving up on public housing thing, right? And like, oh, like we can figure this out with this thing or that thing, this affordable housing, housing first, et cetera, et cetera. Okay, 40 years of chasing other things. We need to have the conversation to go back to, why is Finland doing better than us? Why is Austria doing better than us? Why is the Netherlands doing better than us? Why are the countries like the UK and US, who not only stopped doing public housing like we did, but also sold their public housing, doing a lot worse than us? Have to have this conversation. And New Zealand, because public housing has that deep affordability built in, it's rent controlled, it's permanent. And this time when we do public housing, let's put supports in the building, okay? That's one important thing. All right, so where are we going with this project? Like I said, this is sort of first round of analysis. We are going to draw the picture of the ideal future. We're going to create tools to have the conversations about the policy changes for KT, for people who want to speak to their city council, their provincial, their territorial, their indigenous, or their federal governments. We are going to do our analyses of other countries, and we're going to write this into a free open access book for folks to use and get into. So we've got a lot more work left to do on this project, but this is kind of the first piece of the story that we wanted to tell you today. And I'm so happy to hear that the rest of the conference also is having these big picture discussions again. So thank you very much.
Nice work.
That's all we have to do, folks. We got the plan. Let's just do it now.
This is irrelevant.
So for our last presentation today on preventing homelessness for justice-involved individuals, we have Laurence Roy and Isabelle Gervais from, I should have checked, YMCA.
I'm the YMCA. She's from McGill University.
Okay, YMCA and McGill University.
Sorry. No problem. Okay. Oui. Oh, il est ouvert. Let's just find it, then. Is it good? Good? Well, I'm too small. Am I too small for this? I need an Apple box to put myself above the laptop. Okay, good. Thank you for your presence today. We are thrilled to talk to you today about the process that we went through for about the last 2 years to power meaningful changes towards prevention of homelessness for justice-involved individuals. I'm Isabelle Gervais. I'm from the YMCA. I'm a coordinator for a prevention of homelessness service involving justice-involved individuals. And my co-presenter is Laurence Roy from the McGill University. We'd like to start with a couple of acknowledgements. First of all, we would like to thank the lived experts who participated in our focus groups. Thank you for your sharing and your wisdom and sharing all those tough experiences, and those were essential to the work that we are presenting today. We are also thankful for the experts from the field who committed time every month to the group, even though we all have overbooked agendas. We'd like also to thank the Quebec Homelessness Prevention Policy Collective for the support and resources, especially Emily Knox, our project manager, whose help was indispensable for the creation of the policy report that we are presenting today. Our little plan for today is first of all, to present our context for our work, so the context of homelessness prevention in Quebec. We focused on correctional, then pan away from just correctional and looking at the judicial processes. We'll talk about our phase 1, so policy transformation, our development process, and then the outcome of policy development process, our report of 10 recommendations. Then where are we now? Our phase 2, policy transformation, reaching and implementation. Then we'll end with a little Q&A.
Okay, so we're going to do that. So we're going to stand together. So we're just going to alternate. And I just want to say that I think most of what Dr. Return said we actually we were laughing there because a lot of it is coming out in the report with this more specific population. So thanks for that. Very helpful as an introduction. So in terms of context, so the project we're talking about today was initiated by a coalition called the Collectif Québécois pour la prévention de l'itinérance, so the Homelessness Prevention Policy Collaborative, which really stems from a partnership between the Oldbury Mission and the McGill School of Public and Global Health. And the goal of the initiative was to collectively identify what public, social, organizational policies could be put in place to prevent homelessness in Quebec. This was really an initiative led by the community sector, identifying that not only were we not reducing homelessness, but this was at the beginning of 2020, right before the pandemic, and we were seeing a lot of housing crisis and homelessness crisis. And the idea was like, how could we think about prevention in this specific Quebec context, knowing that there's a lot of provincial responsibilities involved? So the collective really was, the idea was to put together community organizations with on-the-ground expertise with specific populations and match them with McGill researchers and other researchers with expertise in the field. So, and this was done by looking at specific populations where we want to look at pathways into homelessness. So there were 5 streams designed, one on youth, gender-based, refugees and immigrants, mental health, and ours, which was originally the corrections, then turns into the corrections and justice. So the co-leads were Art Campbell at the Y, which leads an array of services, offers an array of services to people who are at risk of experiencing homelessness, including Sortie Carcérale Pleine Fille, which is the program that Isabelle coordinates, and her employer is, her boss is right there in front of the room, so we're treading carefully. And so the impetus for this stream was really that we know from research that there is a really high representation of people at risk of homelessness when they are leaving corrections to the community, and this has been really well documented. So the goal for us was to think about what policies, mostly at the provincial level, but also at other orders of government, could either increase or reduce risk of homelessness for this population. Okay, yes. So I'm just going to lay out how we developed the policy, then we're going to present the actual policy report, and then Isabelle's going to talk about like next steps and implementation. So what there were researchers involved. So what we started doing was a literature review, because that's what we like doing. So we started by hiring students to do a systematic literature review on what services or practices or interventions exist to prevent homelessness from prison release. And there was actually not much published. Like there's a lot of programs that get talked about, but not necessarily evaluated or documented well enough. There were 2 programs on critical time interventions, mostly in the UK, and so basically they don't do anything on housing and risk of homelessness. So we are a bit stuck at that point in terms of evidence. So we turned to, as Isabelle mentioned, the intersectoral working group, which were representatives, and we were careful not to select high-level managers necessarily, but like middle management and intervention workers from different sectors. So corrections, justice services, police, psychosocial services in both correctional services and community. And I'm forgetting some sectors, housing and community services, obviously.
Forensic psychiatry.
Forensic psychiatry as well, thank you. And we also add a group of lived experts for the recommendations. So this is just saying that there's not much published in terms of lit review. So I think that the main takeaway from the cross-sector working group is that they really did not expect to work that much. This really went out of proportions. We ended up meeting either in person or virtually for 2 years every month. And one of the first conclusion was that we really needed to move away from that, like corrections to community transition, and think much larger into all the different steps and moments within the judicial trajectories where people were put at risk of homelessness, from contact with police to after detention community reentry. So that was one of the big takeaway at the beginning. And what we did is that we used, and this is in the published report, it's only in French now, but it's in the process of being translated in English, so it'll be available to all of you, regardless of those language skills. So what we did is we used this visual representation of the criminal justice trajectories, and we asked the cross-sector working group to identify risks of homelessness at each of those moments, and then to map current and potential promising policies that could either increase or reduce or mitigate risk of homelessness at those different time points. And then we asked the group of lived experts to do exactly the same thing. So we showed them this visual. We actually glued to the walls the visual representation of the criminal justice trajectories, and they showed us what their experiences were in terms of risk of homelessness, and then the helpful and unhelpful practices. And so that was very relevant. Then we did several drafts of recommendations that were circulated several times. People got a lot of emails. And then that was shared between the group, cross-sector working group and the group of lived expert. And it came to that.
So all that hard work results in our policy report in 10 recommendations that are separated in 3 axes. The first one is to provide support for individuals. Its main focus is the development of and bonification of services reaching justice-involved individuals at risk of homelessness. The second one is building service-level capacity. The main point regards training and information for all workers who could be in contact with our group of interests, that is from the justice and corrections standpoint to community service and health and social services. And thirdly, improving access to services and cross-sector work. Homelessness is complex and needs adapted services. Not one ministry will be the only answer to homelessness. So this axis of recommendation aims to create spaces for people with complex trajectories to access adapted services and for research to better understand those complex trajectories. And finally, we have one cross-cutting recommendation that aims to include the lived experience expertise in those policy changes. So the first axis is providing support. So I'll go through the first axis and go around like the objective and the main means that we suggest in the report. There are much more means that we suggest in the report, so once it's translated, go and read it. It's a good work. People experiencing homelessness have multiple, simultaneous, and interrelated needs, which require a comprehensive approach to health that is not currently available, including in closed settings such as detention or forensic psychiatry. The objective of the axis is to break down the silos for intervention and facilitate the process for vulnerable individuals who come into contact with it. So the 2 main objectives are to ensure the right to health and safety and improve consideration of the health and psychosocial situations of each person involved in the trajectory. Our 3 main means, the first one is an integration of a systematic assessment method for the risk of residential instability early in the judicial trajectory so that it can be paired with case management services. Aiming who is at risk of homelessness early on in the justice trajectories is the best way that we found of preventing homelessness further down in the trajectory. We suggest creating or implementing wraparound support for justice-involved individuals through teams of what we call in French des équipes itinérantes justice. So loosely translated in English is teams of homelessness justice pivot agents that would be involved on a voluntary basis from the start of the justice involvement. With wraparound support, wraparound support mandate focused on the needs of the individuals, not linked to their justice involvement. Some lived experts told us that the risk of homelessness started way before the detention experience. So our recommendation proposes to pair up with a community worker able to navigate the systems with the person and act as a pivot, an advocate, and also a translator of the different systems and trajectories that they are living through. One of the crucial elements that our lived experience experts shared with us in our focus groups is that those kind of teams needs to be associated with community and or institutional psychosocial services rather than institutions with a legal mandate. This came time and time again in our focus groups. No matter the motivation of projects, the association with a legal mandate is not conducive to building trusting relationships. So it came time and time again that those people, this hypothetical team, needs to be associated with community services or psychosocial services. And thirdly, keeping medical and or psychosocial files open, no matter the instability or the status of the person, so that support can follow them if they are incarcerated or in unstable situations. Other means, access to a decent income, we talked about. So addressing poverty in a meaningful and sustainable way. I won't go around too much on that one. So I'll skip to the part of transforming detention conditions to decrease post-release vulnerability. Several characteristics of prison environments, particularly for incarcerations between 2 weeks and 6 months, increase the likelihood that a person will lose contact with their support system. And one of our recommendations of the first axis addresses those issues and multiple means of addressing those changes. One of them is access to mental health assessment at admission in detention centers and support that follows them after their detention episode. But also restrict the cost in general for phone calls and facilitate access to those phone calls so that people can talk to their family, to their friends, can talk to their worker, their outreach worker that may lose them through all this trajectory. But also facilitate access to visits from psychosocial workers, and also limit transfers between detention centers to the strict minimum to facilitate release preparation. Because if someone starts a work of preparation in Montreal, gets transferred to Saint-Jérôme, which is about an hour and a half, but not the same jurisdiction, not the same workers, not the same services, then comes back to Montreal about 2-3 days a week before release, we don't have the time to prepare anything. The person's gonna get out and be anxious and unprepared. We believe that providing these supports would transform the experience into a jumping point to more stability if we start the preparation inside the detention centers when detention is involved in the justice system, in the justice trajectory of those people.
So I noticed we don't have much time left, and I think Isabel's, no, it's fine. No, but I think that Isabel's part at the end is actually the most interesting. So I'm gonna go quickly over those two other axes. So axis 2 is really around building capacity. One of the things we noticed is that people in the large justice, corrections, public safety spheres really sometimes have very little knowledge of the realities of homelessness. There is a very static representation of homelessness and what risk of homelessness can mean, and we need to unpack that for them to be able to actually change some of the actions that increase risk of homelessness. I'm just gonna name one: release conditions that are completely incompatible with the daily living conditions of homelessness and which just make people at risk of 100% sure breaking their conditions and going back through the system and increasing both their criminalization and risk of homelessness. And this is largely stemming from the fact that justice actors are not equipped or are not understanding those realities. We don't want to reinvent the wheel. We've actually developed over the last 5 years some training tools in Quebec, mostly available in French, but there are some translated, and I can put a link to that later in the presentation. On Homelessness 101, we have the tools to accompany those judicial actors to enhance their capability to actually act in a way that is not increasing risk of homelessness. And then Isabel talked a little bit about silos. So we know that, and I think this is across Canada, I'm hoping it's not only in Quebec, but really there's very, very, very strict silos between the different sector, between justice and public safety, and health and social services. And they're all doing different actions that without necessarily talking to each other. And so that those opportunities for cross-sector dialogue, these are among the things that we're suggesting to implement. So Access 1 was about supporting individuals, access to supporting people who work with justice involved at risk of homelessness individual. Access 3, and I'm just gonna put all of those up, is really about looking at those larger structural barriers. So one of the barriers that we identify is that people are assumed to have access to general services, either pre or post detention, and in reality they don't. Access to services is very restricted for people who are at the intersection of justice involvement and risk of homelessness. One of the examples, so there are many examples in the report, one of the examples is legal aid. People told us that it's sometimes very difficult to have access to legal aid when you don't have the documentation. There's an whole administrative process to have access to legal aid. And then once you actually have access to legal aid, the rhythm of the court appearances, the pace of the meetings with the lawyers, the types of interactions with the lawyers can be extremely damaging, actually, and make people not want to go along the judicial process. And so one of our suggestions is creating an entity, a dedicated entity within legal aid for people who have vulnerabilities or who are at risk of homelessness. Another thing that we've identified that we're unable to do in Quebec, and again, I don't know that much about other provinces, is that we really have little quality data about trajectories. So knowing where people use health, justice services, knowing about housing services. So use of services data are very disjointed, if not impossible to reach, and it makes it very hard for researchers to actually look at the impact of any policy if we don't have access to those data. So that's a recommendation as well.
I'll go through the cross-cutting recommendation fast. Essentially, it's listen and act upon the experiential knowledge of those people that have experiential knowledge of the justice trajectories. On the front of, sorry, I'm losing my words. One of the experts, losing my words.
Lived experts.
Yeah, lived experts.
Yes.
Les objectifs. Essentially, the cross-cutting recommendation reminds us of the importance of integrating those lived experiences, and I'll go through the second phase because I know we're losing time. So if you have any questions, come back to me on that one. Essentially, our second phase of our policy transformation is reaching out and the implementation. So we started with a pre-release meeting with representatives from the Ministry of Health and Social Services, Ministry of Justice, Ministry of Public Safety to pre-release the report and to open the dialogue about, well, we have a bunch of recommendations, and those recommendations, they come together. So how can we work together and break silos and have this conversation seriously about preventing homelessness regarding the justice trajectories? Our timing was really strategic also for the release. We released a couple days after the public release of the last count of the homeless population in Quebec, which revealed 22% of incarcerated individuals are at risk of homelessness upon release. So this also jump-started discussion and dialogue through our report, and we are reaching out with the report and saying we maybe have a start of an answer. Can we talk about it, and what can we do now? Our working group also is mainly a great conductor for those discussions. So we are working also still with the working group individuals, and we are adding also to the working group of other people from the different ministries to implement those phase 2 ideas that we would have. Media and communication and post-release positioning is mostly about moving forward and promoting a global reading of our recommendations. It's not a checklist to pick and choose from. Our recommendations come as a package. They all implement and influence each other. So we promote it as a whole, since every recommendations and means have interrelated impacts. We notice through our work that there are not only silos across the sectors, but also within sectors. So some of our conclusions, which were brought by field experts, were not always understood by higher ups when we talked to them about those issues. So that realization makes us even more aware of the necessity of a better communication spaces and also finding common languages, which is a big part of the work we started with, of learning how to talk to each other and talking about that subject, but through our mandates and through our individual lenses. And this is also what we mean by caring for frontline service providers. Their expertise has to be heard and taken into account when implementing policy changes, so they are meaningful and sustainable also on the front row of the work. And finally, I'd like to finish on avoiding reductionism and oversimplifying the problem. For justice-involved individuals and others, preventing homelessness is not only about access to housing, it's about access to care and about having adapted resources that range through a broad spectrum of needs. So this is what our little report covers. It's bigger, so we'll answer most of your questions. Thank you. Thanks, boss.
Thank you for your attention, and thank you on behalf of all of our presenters. So if we have time for questions now, there is a microphone over there if you would like to use that. Otherwise, if you can really project your question, I will try to repeat anything that maybe people can't hear. But who wants to go first? You need a moment to process. And I didn't prep anything. Oh, great. Thank you.
This is going to hit all of you, but essentially none of you talked about how homelessness is actually profitable in an industry. So especially with yours, when you're talking about like those root causes, I'm just wondering how come none of us are going there? Because if we don't address the way that this is a profit industry, we can address those root problems that you gave, but we'll still have homelessness. And the criminal justice system is also like a for-profit, right? So I'm just wondering if that's on anybody's radar.
Yeah, that's a great question. So the hope really for me is that by having effective policy context, that we will reduce the necessity of services as much as possible. Like I said, there will always be the point of crisis. And folks, for example, some will always need help to stay in their housing and meet their health needs where they live. But again, if we can address poverty in a real way, if we can address housing costs in a real way, then we will reduce the necessity of so many other things for sure. Yeah.
Right, but the people who are profiting aren't necessarily so I do outreach, so I'm significantly underfunded. Like I am actually in the poverty belt, and I work full time, right? And I shouldn't be in the poverty belt. Like 10 years ago, I wouldn't be in the poverty belt, but it moved. So I'm not talking about I would love to work myself out of a job. That's my goal, right? Not realistic in my lifetime, but or maybe it is. Maybe I'm being unfair. But it's like the profit is actually in those governmental systems that you're wanting to create the policies. Like they're the ones who actually make the profit. Like how much does that housing minister get paid? He's on the room to defend himself, which I feel bad about, but how much does he get paid? And how much do regional staffing, because every region has a whole staff, right? Like it's like there's, like the health industry, right? It's still a for-profit industry. Like essentially everything has been made commodified and for-profit. It's like the colonization did, the king did everything for profit, including basic human rights. So I feel like your approach is really great and will do a lot of minimizing. I don't know how you're going to convince governing bodies to make those policy changes because it will effectively reduce a lot of the money that's being made off of the housing crisis and the homelessness crisis. And that money that's being made isn't necessarily even in service industries. And if you took the money that is being distributed everywhere to service industries, it's nothing compared to what I'm sure pharmaceutical companies are making off the homeless crisis. Hospitals are making off the homeless crisis, right? Like, which is, I guess, hospitals are a service industry, but not in the same, you know what I mean? Like, if you went down to needing like 2 outreach workers for every city, you know, like, the amount of money that is like still being exchanged is, you get what I'm saying? Like, it's, like, where the profit is actually like not directly related to, it doesn't seem directly correlated or tied to crisis.
I don't know how to answer.
Yeah, I don't know how to answer that.
No, like, honestly, I think we can do a lot of that diversion of services. We can think, yes, sorry. No, it's also for my we can think, like, my first answer is I don't know how to answer this. I think what we're trying to do is not pinpoint like where the profit is, but think of the housing crisis as a whole, as a systemic issue. And I think by like that, to me, that's a little bit of the first step of thinking about your question is, because what we see, at least in our work, is that homelessness is a health and social service issue. And like there's very little acknowledgement that other sectors are responsible. And to me, that's the first step of at least having that broader lens of this is a collective responsibility. It's not like a housing thing or it's not a health and social service thing. It's a collective responsibility. And I think that then if we acknowledge this, we can maybe start thinking about your question, but I really don't, I have no idea, honestly.
And we have a question in the back.
Yeah, I want to rephrase kind of what she said. See, we invited Trudeau last year, the Kitchener. He came and walked through our 10 cities, seen the problem, and he went back to Ottawa and dedicated $2.2 billion to change the problem. The money left federal, went to provincial. Our city only got like $1 or $2 million, and that got diverted towards that group and that group and that group. And we had a lot of meetings about what to do or talk like this, and oh shit, there's no more money. Have a good day.
Oh,
You
yeah.
know? Why are you guys, it's a systemic problem, you're right, and it's all about profit, and it has nothing to do with actually housing people. So if you don't look at how you guys spend and waste that money, then nothing's ever gonna solve. It should have left the federal and went straight to the builder, and then the problem would have been solved right then, right? The ministry guy for Nova Scotia said, well, I wish I could build houses like that, right? But we need this kind of product or prefab homes, or, you know, we can't just build homes. Why not? Why not?
I do thank you for your comments and for yours as well. I wonder if we might focus questions for our presenters for the rest of the remaining time. Do you have a question?
Sure. It sort of bounces off a little bit, but like maybe brings it back to, I think that, because we're talking about a lot of really complex issues and like neoliberal policies from 30 years ago, the financialization of the housing market and all of these kinds of things. But I'm curious, when you're looking at income and stabilizing people's income, that there's been considerations of programs like direct cash transfers, when we're talking about how are we getting folks money into people's hands directly, if anybody has any, like, anything to speak to that kind of program?
Yeah, for sure. So I think folks probably saw all the news about the success of the cash transfer program in BC. And Savannah and I had a chance to see about a cash transfer program in New York, which is with youth. And so like even more controversial in terms of sort of our social beliefs and stuff is just giving youth cash. And the majority of them use that to solve their housing issue. So absolutely, I think the income is a core issue. I would kind of reiterate my concern, though. Actually, I'll add a concern. I'll reiterate the concern that if all we do is increase income, as has been noted even with rent banks, right, is that just dumps more income, and the rent banks folks were talking about, like, you're actually have landlords who then improve their property value off what they're getting out of the rent bank, and then increasing the rent later. The other warning I would give around income is actually I think there might be a certain political parties who we would not want to make a basic income, because they would very gladly make a very low basic income and eliminate all social services and say this is the new system. So yes, income's at the root, poverty's at the root here, but it needs to be done well, and in congruence with a couple other policy levers, I would say.
I'd like to add maybe through a lens of the justice involved individual. One of the issues we have in Quebec is access to income. Also, the welfare in Quebec is like so under what people need to survive. But one of the issue we have with people that are leaving detention centers is the time it takes to get the welfare. It takes about 3 weeks. A lot can happen in 3 weeks. People have to eat. People have to take public transport. In Montreal, the monthly pass is $100. So jumping the subway starts to be it's a strategy de survival strategy. And then through a bylaw, those people get tickets and have a debt to the city, and then when we eventually get out of homelessness, well, they owe money to the city. So there's a lot of thinking about access also. So if people could get access fast to welfare when they get out of detention centers, and if we address poverty at the root or faster in the justice trajectories, maybe we can avoid detention at all. Like if people get stable housing through their justice trajectories, maybe we can avoid detention. Maybe we could get community service. Maybe there's a lot of other options that exist, and because people are unhoused, are homeless, they get to go in the detention facility that fragilize makes them more fragile and vulnerable at the exit. So there's also this idea of access to the services, to income, and to everything.
I think we had one in the back. First, you still have a question? Oh, yes, there you were.
Yes. Earlier in the presentation, you had mentioned about increasing public housing, which I don't disagree with. My question would be, have you thought of that piece of areas or communities that have the funds, want to do the public housing, but they don't have the space in the city that they're in that's close to the wraparound supports? Like, what is in thinking of that problem, have you thought of what a solution could be to help that?
Pretend. I sing in that one. I talk in this one. That's a really great question. Yeah, love the idea of how do we actualize that for sure. Again, I'm an academic, so I can say things like Pierre Poilievre came to London, and he was asked, because we were doing this transformation on our homelessness system, he was asked what would they do about homelessness if elected. And he said, well, we would sell off these 6,000 underused properties to the market so that housing could get built. And I was like, my God, 6,000 properties, that's what we need to build housing that is truly deeply affordable and will be sustained its affordability, right? So there are lands, again, that, like you said, they're not necessarily in the right places, the right lands, all those sorts of things. So it's going to be at sort of the community level of anything from land swaps to even looking at ways that co-ops and stuff like that can look into different ownership models. And so there is enough land. There's also buildings, right? We're looking, like Calgary's doing this incredible office conversion. London's just doing an assessment right now of potential office conversion. So there are lands, there are properties, there are a lot of lands that people are sitting on, land holding companies. So yeah, it's got to work out that way. And yeah, I'm glad you're already thinking at that step.
Thank you.
Yep.
I'm sorry, excuse me, I'm saying this with all due respect, but at this point in the day, at my age, I'm getting a little bit totally overwhelmed, confused. I think we've definitely identified the system issue. And all I'm hearing from the politicians today is that listen to the Black Party political broadcasts that they want more housing and they're giving tax breaks. Has your research led you to determine that we need to turn the system on its head and start focusing differently? Why are we trying to solve homelessness when the issue that's causing homelessness is the concurrent disorders? Why are we just focusing on homelessness? Do you see what I'm saying, or am I just on a rant here? Like there's so much more that, and so I'm totally confused by this at this point in the day. I love your research. I love what you're coming out with, but how are we going to make that useful?
Yeah. Yeah.
Useful.
Yeah. No, it's great, and I guess I have several hopes, but I guess one of the hopes that I have for this work is that it gives us permission to say the things that we know and that we should be saying, but we've been too kind of thankful for a couple of dollars to say, like, and to actually say, like, you know, your affordability measures nonsense. We know what affordability is. Let us do that. Giving a huge proportion, now it's shifted over time, but at one point in time, over half of our National Housing Strategy dollars were going to low interest loans for private market housing. To tell the government, like, that's insane. That is not solving anything. And so that's what I hope my work does, is it gives permission for people to say, if all the federal government is doing is capital dollars and the provinces are all defunding healthcare, how the hell are we going to keep people in all these buildings that we're supposedly building, right? So yes. So I hope that my work... Absolutely. So I hope my work gives permission for our sector to be bolder, to say the things we've known, and that and I get to say, as an academic, put me out there to say the things that you want said, and I'll say them to the politicians, right?
I mean, they get the same report of all of them, the conversation starts.
Yeah.
Sorry, I think there's just this gentleman here.
I just wonder, can you repackage rent control? Like, rent control dies in the terminology, and like at least where I live, we were told, well, we're open to anything except that. So, like, how do you spin that so that it becomes meaningful?
Yeah. Oh man, we lost the battle on rent control so badly, and I'm going to say, fortunately, like a bit before my time. God, it was so. In the same way that we're really close to losing the battle on public housing, right? Which is it's done, and then it's left to rot, and then we say it doesn't work, right? And the same thing happened with rent control, like rent control, but only these buildings or this area, and then so it does create this, like, it just screws up the market, and then we're like, oh, it doesn't work. Well, we didn't do it comprehensively. And my God, how do we, there's been so many years, there's been 2 decades of people saying rent control, like very intelligent people saying rent control doesn't work, looking at good studies with good data of bad rent control design. How do we change that conversation? I don't think I'm the guy for that. I think you need like economists that people trust to start to look into that. Who can have that conversation about like the finance side of things, maybe. It's a lot of work to recover that conversation.
Did you have? No.
you know, we're at a conference, it's called, you know, Coalition.
Can we change
Like
it?
everything you're talking about, those are the things that need to happen. Right, yeah, we can talk till we're blue in the face, you know, the little things that are Band-Aid solutions, the government coming up with all this stuff, but like you said, where's the avenue, and there's no action being taken for rent controls. You know, it used to be OCAP in Toronto, I'm from Toronto, it was a small group that did that, and they protested, you know, and now it's Acorn a little bit doing that, but nobody's doing anything. Right, where's the venue, what's the avenue for that, who's gonna start that, who's gonna bring that up into the public, you know, it's these little whispers on the news about rent control once in a blue moon. But then nothing's being done. Right, nobody's taking the initiative to do that.
No, that's true. Yeah, and apologies to my panelists. I feel like I'm hogging the microphone. I'll just do this last one and then. So I love the idea of like positive deviance. And so when I think about like positive deviance, it's like people who are making the good things happen in a context where like it shouldn't even be able to happen. And so I do think about like the BC income project, right? Is like they did this, they made it happen in a small place. It got like worldwide news, right? And then I think about like Steve Rolfs in the back from Indwell. They do permanent supportive housing. It's friggin' hard to do permanent supportive housing right now because who's funding the supports? They're doing it. Like, so how can we highlight people who are making great things happen? And so I think, and it's like supervised consumption, right? It's like someone just does it and they show how good it is. So, you know, my hope, I guess, is that some community will do rent control and it'll do it well, comprehensively, and that'll be like, you know, that'll be the one we can hold up and say, like, look at this, look at the impact, and yeah.
So we've got time for just a couple more questions, but I do want to, it is the end of the day, and it's been a very busy first day of the conference, so I would hope that if there are questions that are directly about the presenters' research that we could, I mean, this is great conversation, of course, but we'll get this gentleman here and then in the back.
Thanks for letting me ask questions. Great presentations. I hope I don't get tarred and feathered. Like I've only been a politician for a year.
Oh, you're okay then.
I'm also a politician too. So anyways, and I do think like a lot of our hearts in the right place. The levels of government can be tough sometimes in terms of, I feel like from the local perspective, we have had a lot dumped on us. And from our point of view, we've tried to tie health and homelessness together. Because I honestly do see that there have been some successes on that front, and I'm curious to see what the perspectives of the panelists are in trying to keep those linkages strong, because even the most diehard conservatives can't ignore that if you house people in the long run, you know, that there's the human cost, but then the healthcare cost, right? And trying to, you know, make that argument every chance we get, because really I think that that's where we will see success, because those two are integrally linked. So I'm just curious what the panelists' thoughts are on that.
So for the translator in the back, the question, if I understand it well, is how do you keep the conversation going? Well, between the health and homelessness and linking, yeah. Well, I just spoiled my answer. I think it's communication spaces, actually. I think it's having meaningful communication spaces that are recurrent, that are accessible, and that we can come back to, and creating those spaces, like what we experienced with our cross-sectoral group. When I started, I never thought that would work. Actually, I started like a kind of a side project because of COVID. I couldn't access detention centers, so I had a lot of time on my hands, and I started like going to the group through my employer and everything. And then we started communicating, and we started speaking the same language, and we started to speak about homelessness in the same way, with the heart at the good place, but finding a way to talk to each other through our different lenses, and finding this way of meeting everyone at a different point. I come from the community service. I was an outreach worker for a couple of years. I work with the people in the detention centers, but we talked with the police officers, we talked with the probation agents, we talked with forensic mental health services, and we all finally talked the same language, and we produced a report that we all stand behind with recommendations that interrelate and work together. So it's kind of hard to say now, but it takes time, but we have to talk to each other and like just sit down and have those hard and tough conversations about homelessness and about health and about social services and how we can do better. And it's kind of a dreamy way of framing it, and I'm sorry, so it's not really actionable, but I think that's kind of the first step is talking and finding a common language to speak about homelessness together and just work with that and do the work to find that.
And we have one final question in the back.
Thank you, everyone. This is a very informative session. One thing that's been alluded to a couple times in the question period here, we do see quite a lot of successes from Manitoba. We have some varying degrees of capping rents beyond certain points, but these things tend to be the first things kicked to the curb, especially when we run into tough times like COVID. And so I guess the question for all of the panelists is, you're talking about certain alternative systems or different ways of measuring. Let's say we do get these things and we're talking about starting, getting to the starting point of ending homelessness. How do you make these platforms actually resilient beyond that point, right? Because they tend to get chopped first when we have to, only so much of the pie kind of conversations happen. So I'm curious about that kind of lens, and if anyone put any thought into those elements.
Getting ownership from the others.
So I'm not going to totally answer your question. I'm going to actually offer us a bit of a sort of a hope, or it's almost a prayer of some sort, which is that we're in a democracy, and it's going to change, and things are going to change, and in that change as well, we can lose things. So it's not just crisis time. Naomi Klein taught us that crisis is a time often where we lose ground, but it's also in government change. And I think we have actually a worse time coming in our country. And I think we need to be ready for that, and we need to steel ourselves for what's going to happen, because we are the wisdom and we are the voices that are going to make us get through that time, and have some of us left still for the next change. And so, yeah, I don't think it's ever permanent, it's ever stable, it's ever secure. We saw a basic income pilot, for example, get wiped out. And I do think it's going to get worse for us for a little bit. So we just keep fighting, right? It's that new government, new challenge, new government, new opportunity, right? And then, so lots of times things get done for us that we don't have to fight for. So yeah, I encourage us all to stay strong in what's coming, and understand that we will be the people that are still caring, still pushing, and still considering those at the streets when things get tougher.
I think Laurel's.
Yeah, that's a great question. I don't really have a good answer as well, but I think we did mention in the presentation, caring for frontline practitioners. And I would add, caring for the next generation of researchers, care providers, frontline workers. A lot of them are young women that we see every day, and they're really working hard and overworking themselves. So to me, to be able to not have these people just move out completely of the homelessness of the homelessness system is to care actually for those frontline practitioners, and make sure that they're not leaving. So to me, at least, like, it's not even resiliency, it's just making sure that there are still people doing the work. So that would be my tiny drop of answer to that.
Okay, I think that's our time. So if you don't join me in thanking our presenters one more time. Thank you. Thank you, everybody.